Patients will come to the Hillcrest campus here at UC San Diego at the Antiviral Research Center and enter a tent that looks exactly like this. While they're inside, they'll be administered any number of antiviral drugs that are involved in this trial, and the same thing will happen at clinical trials worldwide.
We have every place where we could wash our hands and get our patients checked in for the study.
The study is run through the National Institutes of Health, and it's called Active 2. Dr. Davey Smith, the virologist at UC San Diego, is the principal investigator for it. He says this trial is the first of its kind to target patients who aren't already hospitalized.
So the first studies that happened were very much about keeping people from dying once they went into the hospital. And this one is to keep people from ever trying to get into the hospital. So in that setting, we have to find people who are early in their infection.
Smith said one of the therapies being tested is a unique synthetic antibody created specifically to attack the coronavirus.
It's going to be infused in them, so we have to have some space where they can get some infusion. It's going to take a little bit of time where we're also monitoring. The nurse will come in, place the infusion, use our Wi-Fi.
Smith says the first stage of the trial will try to recruit around 200 patients, and each patient will get one type of therapy. The idea is to do a clinical trial at a quick pace that tests out multiple kinds of drugs while being efficient with resources like placebos. UCSD physician Dr. Constance Benson, who's also heading the study, has already spearheaded a global HIV research network.
How do you find patients? And that requires that we have staff who are responsible for outreach, community relations staff. And we specifically hire people who can go to doctors' offices, who can go to testing sites.
Of course, she says worldwide efforts are always challenging, especially in a global pandemic.
There's a lot of pressure on all of the investigators and all of the sites to try and enroll people as quickly as we can so we can have answers for these things fast.
Both Smith and Benson say this type of trial is necessary to find therapies for patients that are in the beginning stages of infection. Shalina Chatlani, KPBS News.